Hi everyone, welcome Corps members to our LA Conservation Corps virtual Q&A about COVID-19 and its impact on our community. I'm Gaby Jimenez and I'm a program manager for our Corps member development team with the LA Conservation Corps. Today we are joined by Dr. Barzilay. She's a psychiatrist, and my colleague Adrienne, who will be recording and taking us through these slides. So, Dr. Barzilay, can you tell us a little bit about yourself, maybe about where you grew up, what drew you into the medical industry, and then how you met our colleague, Elisa?
Sure. So I am originally from the East Coast, and that is where I went to school, both undergraduate and medical school. And then I actually did some training in pathology up in Boston. And then it was my psychiatric residency at UCLA in the Los Angeles area that kind of got me out west to Los Angeles, and that's where I've been ever since. Within psychiatry, I really became interested in what is known as reproductive psychiatry. So primarily the work I do surrounds working with moms who have new babies or are currently pregnant or thinking about becoming mothers, and how we can best help them to make decisions about medications and other mental health treatments during that particular period of time.
That's so awesome and interesting. I guess I didn't realize, I'm not a mommy, so I didn't realize that there was a whole field dedicated to that need that our mommies have. So that's really cool, really interesting. So maybe
and then in
Adrienne,
terms of how I met,
yes.
I met Elsa years ago. God, I can't even remember what year it was now, but many years ago, I met her through a book club that we were both members of. And we kind of just enjoyed our conversations about the books and became friends outside of that book club, which is now defunct, but that's how I met her.
Oh, but the connection was made. So that's awesome. The importance of networking. So today we want to talk about mental health and how everyone is dealing with it, how it affects everyone differently, and how stressful these situations can be. So we're just going to share some links with some information. If you are listening and you're not watching the slides, we will have this up on our website, and we'll give you guys the link before we're done with the call. But we definitely want you guys to connect to these links, and we'll go through the slides. And then at the end, like I said, we will definitely post these up on our website so that you guys can all access them, even if you are listening. So some helpful resources that we've included include UCLA's How to Cope with Stressful Solutions. And then we also wanted to share with you guys that LAUSD, starting today, actually, they are adding a resource for all of their school campuses. The number that you can call is 213-241-3840, and all of these calls will be routed to mental health professionals and counselors who will be able to answer your calls from 6 a.m. to 6 p.m. Monday through Friday in both English and Spanish. So if you are having any questions around mental health services, student health and human services, this is the number that you want to call. Again, 213-241-3840. So if you need help or you know somebody who does need help, there are a few numbers that we want to put out right away. And that is the Disaster Distress Helpline. The number there is 1-800-985-5990. And then the second number is the National Domestic Violence Hotline. The number there is 1-800-799-7233. And so if you're coping with stress, we really want you guys to connect to these different opportunities for resources. Fear, anxiety, and the disease can be very overwhelming. So we just want to try to work on ways to deal with it, especially during these hectic times. So with that, we did gather some questions from both our Corps members and our staff. So each of our staff members and our Corps members are asking questions that they feel are important, not just for them, but for the interactions that they have with their families. And so we're just going to go through the slides, and we'll start with question number 1. The first question is, what are some ideas for how to not be stressed and keep our minds off of it, the coronavirus? I haven't been able to sleep at night, and I'm more stressed coming into work. So Dr. Barzilay, what are some tips that you might have for somebody who's dealing with with this level of stress?
Right. So one of the things I wanted to just talk about first, because a lot of these questions talk about stress, or clinically we think about stress as like anxiety. You know, people don't talk about it that way, like I have anxiety, but really it's like that experience of stress. And anxiety is different than some of the other things we sometimes see in mental health, which might be things that are like, you're seeing or hearing things that aren't real, like a hallucination or even depression. In that anxiety it has a purpose, like it's adaptive. If you don't have enough anxiety, you're gonna have problems. Like you might not run away from that tiger that's running towards you, or you might not like study for your test enough, and then you're not going to do well on the test. So some level of anxiety is actually helpful. So it's unusual because you don't want to completely limit anxiety, but you want to have an appropriate amount of anxiety for the situation. I think in terms of what's going on right now with this pandemic, it's even more complicated because it is totally normal to have some anxiety about this. In fact, I think it's appropriate to have some anxiety about this. If you didn't have anxiety, you might not follow the stay-at-home precautions. You might not take additional hand washing precautions or clean your groceries appropriately. You might not wear a mask in dangerous situations. So you actually do want some anxiety. So I want to kind of like normalize having a higher level of anxiety to some degree. The problem, I think, with anxiety is when it becomes so much so that you're not able to function the way you want to. And I think that that's what it's getting into a little bit with the question about sleep and then about going into work. So sleep, I would expect, sleep's not going to be perfect right now. So I think having a realistic understanding of how you're going to experience some heightened anxiety is appropriate. So, but if you feel like your sleep is really kind of getting out of whack to a place where it's creating, like excessive fatigue and excessive dysfunction, where you're really not able to do what you need to do during the day, that is something that I think should be addressed. And one of the best ways to do that is to kind of stick with a routine. And there are a lot of resources about this. And there actually are therapists who practice something called CBT, or cognitive behavioral therapy, for insomnia. And it's basically about having really good sleep hygiene and kind of conditioning yourself and your body into a sleep pattern that's actually like difficult to get out of despite changes in your everyday life. So that would be the first thing I would recommend. There are, of course, all different kinds of like medications and things that can enhance sleep as farther down the line kind of treatments. But as a first intervention, I think sticking to a routine and really having good sleep hygiene can get people pretty far, even in the setting of a lot of anxiety. The other question about coming into work, like I think it makes sense that you might be more anxious about going into work. It's a shared environment. I don't know, necessarily what's going on, if other coworkers are sick and what kind of precautions they're taking. So understandably, an environment where there could be more anxiety, and maybe appropriately should be actually. But something that, is interesting about anxiety is it's like, it is real, right? You're like really experiencing it, but it's not real. It's not like touching you. It's not concrete. It's not there in the moment. So something that people find very useful when their mind is kind of racing and going to these anxious places is to become grounded in the moment and kind of have some tools, some self-care tools to decrease the amount of anxiety in that moment. And that is often like getting in touch with those things that are really tangible and concrete. So that would be different senses. And we think sometimes like of 7 senses, you think of 6, but sometimes like very heavy pressure or like a weighted jacket or holding something heavy can actually be relaxing when you're having a lot of anxiety. So that would be the 7th sense. But taste. So for example, if you chew some gum and just really focus on the taste and the motion and the chewing, like just becoming present on that small thing will actually reduce your anxiety. So sort of having these tools where when you feel like you're escalating in a specific environment can really help to reduce your anxiety and your stress load in that moment.
I love how you phrase that anxiety is adaptive and that it's helpful. That, just on a personal note, like that really helps me knowing that it's okay to feel anxious about the situation. But the level of it is really what we need to monitor.
Right. You want anxiety to work for you. You don't want to have so little that it's not working for you. It should be working to your advantage, not against you.
And I think one important thing for us to remember through this is like a lot of people tend to increase alcohol, tobacco, or drug use. So can you touch a little bit about how that might make it worse?
Yeah, so I don't do this anymore, but I used to work in the field of addiction for a long time. Generally speaking, while alcohol will reduce your anxiety in the short term, for sure. What it actually will do, especially if you're using it daily or in a kind of a chronic pattern, is that it will increase your baseline, your natural anxiety set point when you're not with alcohol will kind of ratchet upwards. So it's like you're getting this relief, but you're actually increasing your baseline anxiety level. Whereas if you can kind of like have a washout period and be free from alcohol for like, let's say 6 weeks or so, usually that baseline will come back to normal and it'll be sort of like what you actually were sort of dealt with biologically to deal with versus this increased anxiety baseline that then is like sort of a vicious cycle of treating it, feeling better momentarily, but then it rebounds even higher. So I don't recommend that, obviously, because you're kind of actually making that baseline kind of worse. That's actually a very temporary thing. And working on kind of like getting the tools and the coping skills to deal with anxiety is something you're going to have, forever, which is a much healthier kind of way to go about it.
Yeah, for sure. Thank you for that added tip. We'll go on to the next question. These past few days, I have heard police, ambulances, and fire trucks pass by my house much more often than normal. I'm concerned about crime increasing. I'm also a little scared when I'm out alone. I have always been cautious and I'm aware of my surroundings, but now it feels different. How can I distract myself from that fear?
Right. So I think and I'm not sure exactly what's going on, because what this person is kind of expressing sounds like something that we would call hypervigilance. And that's an anxiety symptom. That's like when, I don't know if a couple months ago, there were just as many ambulances and trucks going by the house. But because she wasn't or he wasn't in a heightened state of anxiety, they didn't like perceive it. But when you become hypervigilant, you're seeing things and you're kind of more aware of the threats that might be around you. So I don't know what's going on, but that sounds like another kind of anxiety part to it. It also gets into this thing of like, you don't want to have no anxiety. You still want to be street smart. You want to protect yourself. You don't want to be getting too close to other people. If there's somebody who is like behaving in a way that feels threatening, you want to remove yourself from any situation like that. So you want to be street smart, but you also don't want to have functional dysfunction where, for example, like maybe you need to get groceries, but you're so petrified to leave your house or have somebody drop something off that you actually can't get what you need. So you want to have a balance right there. And I think, what they were asking was, how can I distract myself from the fear? And I almost feel like if you're going to, it's almost, I think, more helpful not to necessarily distract yourself from the fear, but to kind of like accept it and be mindful of it without being judgmental. So it kind of introduces this idea of mindfulness, which is an awareness of your surroundings, sort of that being present, being grounded in the present, and kind of like accepting the feelings and sensations and noticing them without judging them. And that can actually kind of reduce anxiety too. Saying like, here I am, I'm hearing this siren, just kind of really like walking through the narrative in your mind of what's going on. This is making me feel anxious. I'm experiencing this. When I feel this way, my heart feels this way, kind of like going through it. And this is what a therapist would do with somebody, can actually reduce the sort of anxious, what we call catastrophizing ideas of like what's going on. Well, that ambulance is going by to get somebody who's got, COVID and they're probably coding. That's all an anxious fantasy, but kind of just being in the moment of saying like, this is what I'm hearing. I'm hearing the sign very simplistically and very concretely can kind of take that anxiety level down a notch.
Yeah, that definitely makes sense. Can we go to the next question? We'll go to the next question. So the next question is, I just think that at this point, there's so much information circulating that it almost makes me fear the unknown even more. My anxiety has gone up in the last week because of the situation we're dealing with nationwide. I personally feel like I don't need any more information because it boosts my anxiety even more. How should we manage staying informed without becoming overwhelmed by the news and social media?
Right. So you have to stay informed on some level, but you don't want it to be excessive, and you don't want it to be something that is increasing your anxiety. So this is actually something that happens very frequently with folks who have pre-existing anxiety disorders that come for treatment. They'll say, like, I think I have this disease and I'm Googling about it all the time. And the way to work with that is to kind of say, you need to set limits. So the first thing to do is to recognize that the information that you're getting is often not completely 100% accurate, right? So it can be sensationalized. It's often because they want to get people to look at it. It's often a negative sort of way of presenting the information, and it can be kind of alarmist too. So it's important to critically look at what the information is that you're getting, and then with that understanding is to pick a couple sources that you want to trust, okay? So you just pick 2 or 3 things that you're going to look at, and those are the only news sources that you're going to look at. You're not just going to be reading everything that comes up. Then the next part of that is to limit the amount of time that you spend on it. So this is different for everybody, but kind of depending on how much time you're spending looking at it, you might say, I take every day, I take 30 minutes and I look at a couple news stories from these different sources. And that's all I do. And I limit it to that. And I can, if during the day I have like thoughts of, I want to check this, or I want to look at it, or wonder what's going on, you kind of like have to put it off to that, like, well, I have this 30 minutes or that hour, or whatever you're going to do, to worry about it and think about it tonight. And that can be kind of like a very useful thing, is just to say, well, I can worry about this later. I have that time, and that's when I'll become informed. And that'll be like an anxious 30 minutes where I'm getting the information, but it's time limited. That's it. And the rest of the time, I don't need to concern myself with it.
Yeah, that's definitely a good tip. I know for myself, I was finding myself listening to like the governor talk, the county supervisors talk, the mayor, and then the president when he was doing his addresses. So I'm thinking 4 hours of information is way too much.
Yeah.
So that's a really good point, just to pick a few sources.
Yeah, just pick some that are in line with the information that you feel like resonates with you and that you feel like is good for you to listen to, and then limit it to that. And they'll synthesize all that stuff for you.
Yeah, that's awesome. And then, there's some things that we think that you can do to support yourself. And just remembering that self-care is really important. You can't pour from an empty cup. So take care of yourself first. And there is a link on the presentation, but we will have that at the end. There are some things that you can do to support yourself. So core members, please remember to talk to your core navigator if you need someone to talk to. If you need guidance, resources, or support, we're here to support you. We also have some tips on here. There's 4 tips. Again, we won't go through all of them, but they will be up on the website shortly. One thing we do want to remember is if you are feeling anything outside of what we are talking about that you feel is out of your control, please call your healthcare provider. The next question is, I've been experiencing so much fear in the last 2 weeks, but I keep a cheerful attitude and a strong image at work. I don't fear for myself, but I do fear for my young children getting infected from me being exposed. If I had a choice, I would stay home with them. Any advice for parents on how to feel better with all of this pressure?
Yeah, so this is, in the line of work that I do, this is like a question I'm getting every day. And I think the way, there's no perfect answer, but the way to think about it is like, you got to, in this situation, embrace being imperfect. This person is asking the question of like, I'm really trying to be cheerful and strong at work. Well, maybe it's okay not to be so cheerful and strong at work. Like, this is something that's very difficult for everyone. We are, especially parents, are right now being asked to do too many things, way too many things, and under a lot of stress. It is not possible to do all that well. It's just not. So you're going to do a pretty mediocre job of everything at the best, maybe. Some things you'll do a bad job at, and that's okay. That's really okay. It's not, you don't have to be perfect. And especially with parenting, we all want to be, but you don't need to be. And sometimes that is like the strength. And that's the next part of that was in kind of embracing the imperfect, you can kind of, you want to like look for the lesson in this. So you can sort of model your own agency or your own strength in that, whenever I think you talk with kids about this, one thing that is sort of a rule is you do want to do that meditation. You do want to calm your own nervous system down before you speak with them. But I think it's an opportunity to teach resilience. It's an opportunity to teach honesty. It's an opportunity to say, Mom is scared too. And we're going to do the best we can together to sort of to show the strength and vulnerability to children, that you don't have to be perfect, that you can be real. And then the other part I think that is helpful for kids and for families and for parents is to look for ways to just become a helper, to say, this is the situation. We're scared, and that's understandable, but we're going to help each other. And that can be something so simple as, when you come in the door, you wash your hands. You do that to help protect yourself, but you do that to help your family. You do that to help other people. It could be something like older people can't see their grandchildren or they're lonely. Why don't we write a card? Why don't we write something to somebody else to help them? So in that, you kind of can have that agency and at the same time be very real and be very vulnerable and in that be very strong.
Yeah, those are some really, really good things that we can start doing, implementing right away. So thank you for those. We will move on to the next question. Actually, this is the next slide. We're giving tips for parents, a little bit different than what we talked about, but some of it is repeating. So we will have this up on the website. These tips are for our parents. Children and teens react in part on what they see from the adults around them. When parents and caregivers deal with the COVID-19 calmly and confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially children, if they are better prepared. Here are some things you can do to support your child. Take time to talk with your child or your teen about the COVID-19 outbreak. Answer questions and share facts about COVID-19 in a way that your child or your teen can understand. Reassure your child or your teen that they are safe and let them know it's okay to feel upset. Share with them how you deal with your own stress so that they can learn how to cope from you. Limit your family's exposure to news coverage of the event, including social media. Children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep up with regular routines. If schools are closed, create a schedule for learning activities and relaxing or fun activities. And lastly, be a role model. Take breaks, get plenty of sleep, exercise, and eat well. Connect with your friends and family members. Next slide is a question about family and friends. So with family and friends losing their jobs around us and some people living paycheck to paycheck, how should we cope with the financial stress of not knowing what's next? Similarly, how can our core members be an emotional support to their parents who may now be unemployed due to the COVID-19 layoffs?
Right. So, yes, there were a couple parts of this question. One of them is just really dealing with the unknown. And that is very stressful. We like to think that, and many things we think oh, this is what's going to happen. And it is what happens. And that gives us sort of, I think, a little bit of a false sense of security that we can predict the future, but we so can't. And we really live with a lot of unknowns that we kind of don't deal with every day. But something like this pandemic, it just really shows us how we don't know. We don't know what the future is going to hold. So kind of coming to peace with that uncertainty and coming to peace with the unknown is something that I work on. We all work on all the time, but it can kind of help. One of the things is the financial thing is just, that is what it is. There's not much that you can do about it, but you don't know what the future will be. It could be worse. It could be better. It could be different. So some of the people who have lost their jobs could wind up in a worse situation. They might have other resources and figure something out and do okay. So just kind of really realizing that, yeah, the bad is a possibility, but there's other possibilities too, and we don't know where this would go, can kind of release some of that catastrophic thinking. I think it's also dealing with what you know, what you don't know, what you can control, what you can't control. Mm-hmm. Sometimes it can be helpful to find something that you can control, like you could organize your books, or you could, small tasks that give you a sense of accomplishment and some control in this situation can be helpful for people. So that might be a way to kind of relieve some of that stress when those thoughts become overwhelming. And then the other thing, again, is I think that this question is asking about financial support, and there's often not too much that can be done about that. But there are a lot of different ways to support people, and one is emotionally. And that kind of helps you to become a helper and feel like you have control over something. You can check in on those people. You can support them emotionally. You can support them in a lot of different ways. And that, I think, would be helpful to them and also the oneself. So that's kind of how I would say to think about that a little differently.
Yeah, those are some awesome tips. I know that for me, my house has never been cleaner, and I'm trying to get everything organized. So that's helped me kind of stay focused on like the small things that I can control. So those are definitely some great tips. Next question is, most core members asked this question: how much longer will this go on? This is a very hard question to answer. So we just would like some recommendations for how, if any, we can keep others at work motivated, positive, and as stress-free as possible during this time of uncertainty.
So I think, I wish if I knew, it would be wonderful. Here's what I know. I mean, the projections are anything from short to really long. I will say that this can't go on forever. That there's so few things that I can say with certainty, but that is pretty certain. Like, there is a point where this cannot continue to go on. So this will end. I don't know when exactly, but it will. So that can be comforting to think, like, we don't know exactly when, but this will end, at some point. I think kind of thinking in that longer term, like, oh my God, is this going to be 2 years? Is this going to be 2 months? Is this, what is this, can be depressing and very daunting. And so sometimes I think it's helpful just to kind of like set a chunk of time that you're going to think about and really limit yourself to not thinking past that. And that might be different for everybody, depending on where they're at. So you might say, okay, I'm just going to think about the next month. Okay. And I know I can get through these next 30 days, and this is what I'm going to do in these 30 days. And I'm really not thinking past that, because who knows what's going to happen. And I'll figure out that when I get there. But I'm just going to break it up into more manageable things to think about in terms of my future. And that can be helpful to kind of limit the amount of worry and limit amount of down the road kind of planning or, catastrophe kind of thoughts. In terms of the work environment, I don't think it's realistic to have it be stress-free. That's probably not going to happen. But I do think there's a positive part of this. And I think, just the very fact that you guys are talking about this, I think noticing the good in the world, looking for the people who really want to help, who are checking in on people. I think it's okay to kind of like take a heaviness break and be silly and laugh and just engage in like stupid things. Give yourself that freedom. Some things that can be like joking with coworkers or, things like that. I think it's okay, and we need that at this time. So I think there's no perfect answer to that, as there is not with anything, but I think you can make it a little bit more manageable.
Yeah, that's very, very, very true points. Let's go on to the next question. So this question is, I would like to know, what are some services available for a person that is having suicidal thoughts due to being boxed in and isolated from friends and school?
Yeah. So one of the things so suicidality is complicated, but I will say it's not ever, there's a lot of things I'm like, okay, anxiety is normal and, it's understandable. Like, suicidality, in my opinion, is not normal, and it is something that needs to be addressed, and you need to get help for it. So if that's a thought that somebody's having, you need to see a professional and get treatment for it. And it's something that people are very good at helping others with the correct kind of treatment. Suicidality is complicated too, in that it's a really like a range of different thoughts and feelings. And this doesn't kind of say what it is, but it can be anything from, gosh, like maybe if something were to happen to me, that would be okay. Like if I wasn't here anymore, that would be okay. All the way to, I have a plan on this day, and this is the means by which I'm going to end my life, and I'm starting to give things away, and I've got my things in order, and that's on the other side of the spectrum. Both are concerning, but there is sort of a range of where people fall on that. And working with an appropriate therapist and or psychiatrist is helpful in terms of the type of treatment that's best for an individual. There is help for people who are having thoughts like that. There is a national suicide hotline that they can call. If you're one of those people who's having more kind of serious thoughts with planning about what you might do, I think that the best thing to do is actually call 911. There are specific psychiatric emergency response teams that are trained to help and assess people who are having thoughts like that. You can also go to your nearest emergency room where they will have on-call mental health providers to assess people and see how they can help them. And then the other thing is to let others know. The worst thing about suicide or suicidal thoughts is people often feel really embarrassed about them and don't want to talk about them, but that is the only way to get help for them. And it's not anybody in mental health has competency, and it's not the first time they've heard of it, and they know how to help people. So that's what I would say.
Okay. And then the same would apply if somebody shared with you that they're having these thoughts, right? Try to connect them to these services.
I would, yeah. If somebody's having suicidal thoughts, they absolutely, I would recommend that they get professional help. That's not something that's very painful to live with that. And there's no reason not to get help.
Okay.
And it should be something addressed professionally. I mean, what you're the thing about suicide is that is the worst possible outcome in medicine. So something that should be treated, we kind of treat that a little bit more robustly. But it should be.
Okay, so we absolutely that's a very valid and important point. And we understand that if you are quarantined, you may have been exposed to COVID-19. It can be stressful. If you are exhibiting any signs of being sick, everyone feels differently after coming out of quarantine. Some feelings may include but are not limited to having mixed emotions, including relief after you're done with your quarantine, stress from the experience, sadness, anger, guilt, and there's other emotions that are emotional items or mental health changes that you might exhibit. And so if you are somebody who has been ordered to quarantine, please make sure that you reach out to somebody for those services. If you or someone you care about is feeling overwhelmed with emotions like sadness, depression, or anxiety, and you feel like you want to harm yourself, again, we ask that you call 911 in an emergency. And there's also a disaster relief helpline. The number there is 1-800-985-5990. You can also text Talk With Us to 66746. And again, we'll give you the National Domestic Violence Hotline number. That's 1-800-799-7233. Some other helpful hints links that will be up on our website include cdcs.gov /coronavirus, thepublichealth.lacounty.gov, coronavirus, and that's corona-virus.la, and then the last link is who.int. So all of these links will be up on our website, so you can click on any of our websites. We do ask that you guys follow us on social media, and also we have a resource guide that has just been finalized that we have up on our website at www.lacorps.org/resources. And for those of you listening, that's lacorps.org. And you can also text us 515-999-6356. And again, follow us on social media for up-to-date information, including resources and what we're doing to stay active in the community as an organization. to help support our community members. But Doctor, we would like to thank you for taking time out of your busy schedule amidst all of this craziness going on in the world to talk to us and to our core members. You gave us some really, really insightful tools and guidelines that we can use immediately. And so I know that I have enjoyed our time together. So we just want to thank you for taking the time.
Oh, of course. Thank you for having me.